You may have been told that you have polycystic ovaries, and this may have caused you considerable anxiety. It's really important to understand that about 1 in 5 women have that type of ovary. It's not a disease, it's just like everyone has a different face, so your ovaries will be your individual ovary. What a polycystic ovary is a normal ovary which is a little bit bigger, and they aren't cysts, so it's a very misleading name. They're unruptured follicles, so each little cyst, if you like, although it isn't a cyst, contains an egg which could develop into a baby. So you may have something called polycystic ovarian syndrome, and that's a condition which usually involves that type of ovary. But women who have the syndrome will have 2 out of 3 things. So they may have the type of ovary, they may have infrequent periods, and all that means is that they ovulate infrequently, and they may have symptoms of excessive male hormones. All women have androgens. Those are classically thought of as male hormones, but they're important female hormones. But if you have more than the average woman, then you might develop acne or facial hair or excess body hair. So that can be a problem for women who have polycystic ovarian syndrome. And some of the women with this syndrome struggle to conceive. However, not all women struggle to conceive, and although you ovulate infrequently, all it takes is one ovulation to get pregnant. And so if you have the syndrome and you don't want to get pregnant, then contraception is really important. So I manage this condition in quite a pragmatic way. Many of you who have seen gynecologists or your GP may have had blood tests. However, I think where you can manage a condition by the symptoms alone, it's often better for the patient. Many patients with this syndrome struggle with their weight, not all though, because different things are important to drive the condition. However, if you have it, so you have the type of ovary, you have infrequent periods, and or symptoms associated with excessive amounts of male hormones, then weight loss is absolutely crucial to controlling it. And it can be very difficult to lose weight and very difficult to maintain motivation. And I think it's important to explain that so that you can access support somewhere. The lifestyle is what's important. Nobody's asking women to stop eating. That would be the wrong thing to do, but regular exercise, at least 5 days a week for half an hour, which can be built into your normal lifestyle, and a sensible eating plan. So small, healthy meals, ideally consumed before, I don't know, early evening time. So my management plan for affected women is kind of a 5-pronged approach. If you're overweight, weight reduction is crucial. Now, it's important that you understand the reason for this. There is something inside our bodies called sex hormone binding globulin. And I like to think of this as a big sponge. So if your sponge is a good size, it will mop up all of those excess male hormones and you won't have a problem. Unfortunately, as your weight goes up, the size of your sponge goes down, and therefore it's less able to mop up those excess male hormones. So if you're a woman who's struggling with her weight, then your sponge is going to be smaller and your circulating male hormones level will be higher. So that's number one reason for losing weight. And also, if your weight goes up, you can become resistant to insulin, which puts you at risk of type 2 diabetes. But insulin is also a multiplier, so it promotes those higher levels of male hormones. Now, this is an interesting fact. So you can change the appearance of your ovary by reducing the amount of male hormones. So I think that gives an indication of the amount of potential control that you have over this condition. And there are a couple of really important things here. If you have the condition and you aren't supported to manage, for example, your weight, then your risk of cardiovascular disease, that's high blood pressure, heart attacks, will go up. Your risk of becoming diabetic will go up, which also increases your risk of cardiovascular disease, and your risk of developing cancer of the womb also goes up. So those are some very good reasons for taking control of this condition. And it's a really complicated endocrine condition, but I'm doing my very best here to simplify it. So another way of managing this is to use a drug called metformin, which is used for controlling diabetes, and that's quite controversial. It's not used routinely, but it may be appropriate in women with the syndrome who are trying to get pregnant. And as I said, it's not impossible to get pregnant. Your fertility will improve dramatically as your body mass index comes down, particularly if you can achieve a body mass index less than 30. And if you do want to have a baby, then we would recommend that your body mass index is below 30, because that will reduce your risk of complications like blood clots in the leg or the lung, and it also improves the health of your baby. For the higher level of male hormones, we can use anti-androgenic hormones to try and reduce the level of those male hormones. So the easiest way to do that is by using a combined pill called Dianet. Now, in this country, it's not licensed for contraception, but it will provide contraception, and it'll also reduce the circulating levels of male hormones. Not all women are able to take combined pills. Things that would prevent you having the combined pill are smoking if you're over 35, having high blood pressure, having migraine where you have aura, and that's usually visual, and it's black spots when you're within your visual field, or shimmery lights on the outside. Having a family history of blood clots in a first degree relative, that'd be your mum, your dad, brother or sister, under the age of 45. So there are reasons why women might not be able to take the pill, but probably for women with PCOS, polycystic ovarian syndrome, the most significant risk factor is body mass index. So I'm not obsessed with weight, but it's very, very important in this condition. And if your body mass index is over 40, you can't have the pill. And if it's over 30, then your risk of blood clots, which is the most significant risk factor with the pill, will go up. However, good news, you can have any progestogen-only method of contraception, which is progestogen-only pills, implants, injections, and any of the intrauterine systems like Mirena or Levocert, and copper coils. And copper coils will not affect your weight, your moods, your skin, so they're a great option for many women. So I hope I've given you something to think about. There is a very good website for patients called Verity, very supportive, and I think it's really important to have that peer support, to understand that it's not your fault if it's more difficult to lose weight, and not to lose hope, because as your weight comes down, your self-esteem will improve. And you will be able to achieve anything that any other woman can do. So it's just a case of having an understanding of the condition and the long-term consequences of not managing it. So that's the end of today's podcast. Thank you.